So for today's blog, we're talking about concussions or MTBI and how those happen, what causes it. And it's a neurologic condition, so it's best to talk about, primarily what happens in the brain. So when you get a concussion, it is from a forceful movement of the brain within the skull. You can hit your head, but you don't have to get a concussion. And in this image, you can see that the patient hit their head on the right here in the front, and the brain is moving inside the skull, creating that impact and inflammation right here. But what also happens is you get a shearing of the nerve cells, which are called axons, to where they can be stretched, they can be torn, or they can be completely broken. And that's what causes all the neurologic symptoms that we see in people. So it's very much like the ion changes that happen in the brain and the nerve cells when you have a migraine as well, because it basically just throws the entire neurometabolic firing of the nerves completely off and they go haywire. They're like in a toxic soup of inflammatory or excitatory chemicals. And that's what really leads to a lot of the issues that people have. And so, how do you treat this? Well, we have to know where the problems are in the brain because every concussion is different. And most concussions affect certain cranial nerves. And this is a schematic of the cranial nerves. And most of the ones that are affected are eye movements. And that's why you see people on the sidelines of football games checking football players for their eye movements because a lot of times the ocular nerves, like this ocular motor nerve here, is stretched. The abducens nerve is stretched, which are all moving the eyes. The other nerves that get stretched and damaged a lot of times are going to be the vestibular nerves and then also the vagus nerve. And so that can lead to balance issues, coordination issues, reading issues, ocular issues, and autonomic changes in your body. Autonomic changes would be, changes in heart rate, blood pressure, digestion, things like that. And so you have to figure out which nerves have been affected. And then we harness the power of neuroplasticity to rehabilitate these nerves and help the brain grow new pathways so that people can heal. That's what's amazing about the brain is it does have the potential to rewire itself, change, and heal. One thing that we have to consider as well with concussion patients is that there's also damage to the neck. And so this is a diagram of all the neck muscles. And a lot of times we're going to see patients coming in with trigger point spasms and small tears in the neck musculature in muscles like the sternocleidomastoid, the splenius capitis, occipital muscles, the levator scapula. And we have to get those trigger point spasms out if we want to get their ability to perceive where their neck and space is back and the neck pain and the headaches gone as well. So a comprehensive and integrative approach to concussion care is a necessary component of treating the condition successfully.